I'm Yvonne, and I'm a dental hygienist, and I work in Lorton, Virginia at Aesthetic Dentistry of Lorton. And I'm here to talk to you today about flossing. And I know usually when you come into the office, the first thing the hygienist or the doctor says, have you been flossing? We make you really feel guilty a lot of times. But there's a reason for flossing. Flossing is to prevent cavities, and flossing is also to prevent periodontal disease as we get older. So bacteria gets in between the teeth, and the bacteria is what causes periodontal disease and cavities. When that bacteria gets in between the teeth and we brush, we can't get in between the teeth. So flossing takes care of that problem. As this bacteria builds up and we take in sugars, the sugars in the bacteria produce an acid, and that acid is what causes cavities. As that bacteria builds up, it causes inflammation in between the teeth, and then our autoimmune system kicks in and we start getting this little battle in between the teeth, and we start getting a lot more bleeding. The autoimmune system is trying to get rid of the infection, but we're not helping because we're not flossing. So as this bacteria builds up over the years, like if you come in and every 6 months your doctor or your hygienist says you have gingivitis, then there's a problem. The gingivitis becomes periodontitis, and what that means, it is not reversible. It can be taken care of because it does become periodontal disease, but you've got to remember gingivitis can be taken care of at home. If your hygiene is good and you floss and you brush twice a day and you floss once a day, you can get rid of the bacteria with no problems. Gingivitis, if it continues, all of a sudden that autoimmune system, it says we just can't work anymore. And what happens is all of a sudden your gums start pulling away from the teeth. And when your gums start pulling away from the teeth, that's when we get what we call pockets, spaces between the gum and the tooth. And bacteria just builds up in that area. And then we start getting bone loss as adults. This can be taken care of. We can put it in remission, but you really want to take care of it the early stages. And if you can floss when you're younger and continue to floss and prevent periodontal disease, that's what you want to do. So what we're going to do today is we're going to demonstrate flossing. I know it's the hardest thing for most people to do, so I have Stacy from our office, and we're going to show you exactly what to do. So what we do is we take about 18 inches of floss, and a lot of people try to wrap it around their pointer fingers. What I recommend is wrapping it around your index or your middle finger until you're about this far, and you only have 2 inches that you're working with. I call these my crab claws. That's an easy way to remember. So you hold your floss, you always have that working space of 1 to 2 inches. So if you do that, you can control the floss. So for Stacy, I'm going to actually show you down on the bottom first because it's easier to see. So what you do is once you wrap it around, you hold it so you can manipulate it with your fingers. That makes it much easier. And you slowly and gently slide it in between the teeth. And you go up and down on one side of the tooth and up and down on the other side of the tooth. And then out. Now, flossing is an up and down motion, not a shoe shine motion. You can slide in between like that when the contacts are tight, but otherwise you're going up and down and then you're pushing it back, up and down. We'll try it on the front top tooth so you can see up in this area. And you'll see that it goes up under the gum area. It slides up under about 2 or 3 times, up and down, and then over on the other side. You make a soft C around the tooth so you can go around the curve of the tooth. If you practice this, and you just practice wrapping it around your middle fingers, it'll make it a much easier job. I do have patients come in and they've been flossing for a long time, and if they hold it differently and they can control it, that's great. We don't change the way you floss. Just make sure you floss correctly. Children, we usually start to teach them how to floss between 6 and 8. Their dexterity is not that good at an earlier age, and they have a hard time holding floss. We have floss holders for children that are similar to adults, but we usually ask the parents to floss the children's teeth at least once a day in between the teeth. Now, I'm going to show you a variety of different tools or different aids to flossing. If you're arthritic or you have a hard time holding floss and getting in between the teeth, there are different aids that we use. We have what's called a floss pick, and you just slide it in between the teeth. It's very easy to use. We have what we call, let me just open this up. We have little proxa brushes, and they're in different sizes. This one's very small, and it just slides right in between the teeth. We also have floss threaders that go up underneath the gum. And this is a piece of floss. You buy it in the store, and one end is stiff, okay? And this is your floss, and you slide it up underneath bridges. So if you get it up under a bridge, then you use the same method. You floss and you just slide it up underneath. Lots of different methods, lots of different things that we can use for flossing. We have a floss holder here. It looks like a slingshot. It's fairly large, but for people who have a hard time getting in the mouth, this works very easy. So your hygienist, your dentist, they can show you lots of different methods or different ways to floss your teeth. So remember, a healthy mouth is a healthy body. Thank you.